It was the early days of the pandemic, and Jessica wanted to do something, anything to help. So she jumped at the chance to be a case investigator for San Diego County's contact tracing program.
It was a pretty steep learning curve. We were thrown into the mix within just a few days of training, but after a few days of pretty rigorous training, I would say that I caught on pretty quickly.
KPBS is not using Jessica's real name and has distorted her voice to protect her livelihood. She is part of a contact tracing program that at one point employed nearly 1,000 people and has so far cost the county millions. Despite this commitment, it became clear within months that it wasn't nearly enough to stop the spread. During the summer surge of 2020, just 11% of people with COVID 19 were being contacted by a case investigator within a day, far short of the county's goal of 70%. Now, more than 18 months into the pandemic, experts are looking back on the program to examine how it could have been changed to be more effective. Rebecca Fielding Miller is an epidemiologist at UC San Diego.
Contact tracing is the most useful when you think of it as putting out flare-ups rather than dealing with a wildfire. Um, so in the very beginning, February, March, April, um, yeah, it was really important to catch those flare-ups as quick as we could. But of course, it was hard with how hard it was to get a test and how long the turnaround was. Um, I think when we got into the real peak of it, you could not tamp down that wildfire with case investigation and contact tracing.
County officials would not agree to be interviewed for this story, but county spokesman Michael Workman insisted in emailed responses to questions that the program is worthwhile. Still, he acknowledged that even now, the county is only able to reach and interview about 50% of people exposed. Jessica feels her work has made a difference, but the job has taken a significant toll on her mental health, especially since the COVID vaccine became available and the virus became even more politicized. People will scream at her and tell her she can't control them and that COVID is a myth.
It can feel like a Sisyphean task at times when there are folks who just don't want that information or potentially are going out into the community after perhaps they've tested positive or have been exposed, knowing that they are potentially probably exposing other people to this virus, and knowing that there are some people who don't stop to think about how that can be affecting other people in their own community. It's it's a heartbreaker.
Then another setback. As vaccination rates increased and case counts decreased in the spring and early summer, the county cut back its contact tracing staff by nearly half. Then, as the Delta variant surged, the county tried to hire back the contract tracers who'd been laid off. Cases will likely surge again over the holiday season. But in 2022 and beyond, as COVID becomes endemic, not a pandemic, contact tracing will prove especially useful. So says Fielding Miller, the epidemiologist.
Think of the wildfire analogy, we will be more in a place where we're keeping our eye out for hotspots. The quicker you can stop a hotspot from spreading, the better off everybody is going to be.
Meanwhile, for Jessica, the heartbreak continues.
I just had someone call me yesterday asking me if the county could help in any way, because she was going to miss 10 days of work and her employer was not providing any kind of sick pay for her.
Despite the stress, she will keep working as long as she's needed. Claire Tregesser, KPBS News.